Hi, my name is Dr. Tom Rofrano, founder of the Natural Medicine Clinic in Palm Beach Gardens, Florida. And I have had the opportunity to see over 100,000 patient visits over the last 34 years. So today I'm going to talk about how a stomach bug called H. pylori can cause your gut and thyroid issues and how to fix it. So what is H. pylori? It's a bacteria that can inhabit your stomach. It's found in actually over 50% of the world's population has it, over 80% in some undeveloped countries and in North America, over 20% of the people are estimated to have it. So it can cause all kinds of symptoms. It's the primary cause for ulcers, gastritis, abdominal pain, burning, reflux, constipation, diarrhea, and also belching. Bad breath is caused by H. pylori. And you can get other conditions as well, like autoimmune conditions, thyroid, Hashimoto's, Graves', skin conditions can all be attributed to this bacteria. And anemia, what happens, you develop malabsorption and can develop anemia, and esophageal and stomach cancer. H. pylori is a prime cause for that. So it is important, if you have any of these symptoms, to be aware that this might be an issue. And how do we even find out about this, that if you have it? Well, if you have some of the symptoms I mentioned, you can, there's 3 different tests. I recommend this stool test. I mean, there's a blood test, which is not as accurate. Actually, a breath test. And the reason why I'm not fond of that is because you have to drink this liquid, which is loaded with aspartame, which is an artificial sweetener. Plus, you can get some people get side effects from the drink, like burning of the throat and stomach, nausea, diarrhea, you know, the things that most people have that are getting this checked for. So anyway, I prefer the stool test. It's accurate, it's easy to do. So that would tell you if H. pylori is an issue for you. And it's interesting because I'm going to talk, I've had 5 patients recently with H. pylori, and I'm going to briefly talk about their issues and how we're able to get it cleared up, and what you can do about it if you end up having it. So as far as treatment goes, the traditional treatment is antibiotics. Well, they call it triple therapy originally, which is 2 antibiotics and a acid blocking drug. And that over time it has not been that effective, so they've come up with like quadruple therapy, and which is of course an additional drug, and they have like different combinations of hybrid therapies. Sometimes you may be taking 14 prescription pills in one day for 2 or 3 weeks. And the success rate varies from anywhere from 29% to 90%, depending on the person, the area. Antibiotic resistance has evolved over the years, so it's shown not to be as effective. So that's why they've had to keep changing and increasing the dosages, and sometimes they do 3 or 4 drugs for 2 weeks and then do other drugs. So anyway, that's the medical treatment. There's also some natural treatment, which I'll go over, that I've seen recently. These patients that have come in with this, we've been able to get that cleared up. So I'll go over how that works. Initially, there's basically 3 steps. 1, first you have to, if you have symptoms, you get it tested and find out if you even have it, of course. And then 2, there is a diet that I like using. I call it the free diet. It's a diet that's free of not only gluten, but gluten, grain, sugar, yeast, all those foods that are commonly inflammatory, because when you're dealing with bacteria, the bacteria love feeding on sugar and starches. So you want to help to starve them, basically, while at the same time giving products that help clear them out. So that's where the free diet comes into play. And what we can do is put a link down below, and I'll give you a copy of phase 1 of the free diet, at least so you'll know how to get started with that. And as far as supplements go, to what I found to be helpful, so to give you an example, I had a patient, say a 20-year-old woman who had extreme stomach burning, reflux, pain, bloating, black stools, which is common. That typically means ulcerations and bleeding in the stomach. Her stool test came back positive for H. pylori. And then I had a 36-year-old woman, severe fatigue, weakness, nausea, constipation. She ended up with iron deficiency anemia and other deficiencies, which are common with H. pylori. I mean, she was so fatigued and weak that she couldn't even work for 2 months. And they said, oh, they told her she had anemia and to take iron, but that wasn't really helping because it wasn't fixing the underlying cause. She was obviously bleeding, had internal bleeding, which H. pylori can cause ulcers. And then a 67-year-old man, we had constipation, diarrhea, bloating, abdominal pain, heartburn, and then another woman, 37, similar symptoms, nausea, vomiting, constipation, bloating, iron deficiency anemia, very weak, couldn't even exercise, and all of them had low thyroid function, every single one, and gluten sensitivity. So the diet, by the way, free of gluten and grains is, of course, helpful in that area as well. And then the program involves a combination of different supplements. I used a very strong probiotic, as well as it's our supplement called Gastroblast, and it is a combination of different nutrients like masticum, licorice, zinc carnosine, cabbage extract. So these are all compounds that have been shown to be very helpful with this condition, and it helps the stomach lining heal as well. So probiotic, Gastroblast, the curcumin we also use, and N-acetylcysteine and GI Men. Those are all compounds that when used together can really help with this. So all of these patients I mentioned, and this is only in the past 6 months, we did a 3-month protocol, and they all got better when we did a test. The step 3 of this, by the way, is you have to retest to make sure it's better. And all of them had it cleared up, as well as most of their symptoms. All their gut symptoms had cleared up, and skin symptoms are also like eczema, rashes, itchiness. Those are all common symptoms as well. They typically clear up as you follow a protocol like this. I did have one patient, a 37-year-old woman with all these similar symptoms that I mentioned. Now, when I retested her, it wasn't better. And the difference, when I look at the differences between them, she was the only one that drank alcohol. She didn't quite follow the free diet 100%. She drank alcohol, well, quite a bit every weekend. So alcohol is very inflammatory to the stomach lining. You know, it contaminates the stomach lining. So here you are trying to heal the stomach, and so alcohol. That's why alcohol is out on the free diet phase 1 for that reason. So when you're going through this, it is important. Hey, look, if you want to get better, you just got to stick with it 100%. I mean, we know this works, so it's a decision. If you want to get better, then you have to stick with what works. And in the midst of all this, actually, there's another person who had H. pylori. and it happened to be, this was, I don't know, sometime over the last 6 months in the scheme of all these patients. Actually, I was testing another company with their stool testing, because I like to always use the best testing, the most accurate. So all my colleagues were talking about how great this one company was, so I was comparing their stool test to the one we've been using. And so I did it on myself. Actually, 3 companies. I used the original one and 2 others. And to my surprise, the company that I've been using all these years, I came back positive for H. pylori. And now it's possible to have no symptoms and have it. So currently I wasn't really having any symptoms. I've had a whole ton of digestive symptoms and thyroid, of course, in the past, and Hashimoto's and skin and joint, all kinds of issues, autoimmune and other. But I hadn't had any gut symptoms in a while, and yet I came back positive for H. pylori. So I did this same protocol. Actually, I did it for 6 weeks, full on. I did extra, actually, and I wanted to, I just wanted to see if it would work in 6 weeks. So I did it for 6 weeks instead of the 3 months, and I retested and it was all better. So this is, I hope this has been helpful to you. And if you have any of these symptoms or you know anyone that does, feel free to share this video. And I'll leave a copy of the Free Diet Phase 1 below. By the way, we just released recently the Free Diet book. So I'm proud to say that's doing really well. So I appreciate all your support for those of you that have it and have read it. And the Free Diet Phase 1 copy, like I said, I'll leave below. And feel free to subscribe to my YouTube channel if you want early notification of new videos. Thanks for joining me today. I really appreciate that, and look forward to seeing you next time. Take care.